Hello, and welcome to One Hope Centro de Vida. We are a grassroots, community-run clinic providing affordable healthcare in Albuquerque's International District. We're so grateful that you're joining our volunteer team. Before you get started, we want to show you around the clinic and tell you about what happens when a patient makes an appointment here. Let's get started. When a patient first arrives at the clinic, they check in with one of our front desk volunteers. They'll sign their name and time of arrival. The volunteer or staff member at the front desk will pull the patient's file and set it aside. One of the bilingual patient care assistants will retrieve the file and call the patient when it's their turn. Once the patient is checked in, they take a seat in the waiting room until their name is called. We try to have food available and something fun on the television so they feel relaxed and at home. Once the patient's name is called, they have their vitals taken. All patients, regardless of reason for visit, will have their height and weight measured, blood oxygen and blood pressure measured, and temperature taken. At least twice a year, patients will also complete a vision test. All vitals information is entered into the patient's electronic medical record on this computer. After vitals, patients are escorted to an exam room. The exam will be conducted by an interdisciplinary team supervised by an attending physician. More on that in a sec. Each exam room has wall-mounted files containing copies of all the forms you will need to order tests, request referrals, and so on. They will also be stocked with extra clinic supplies, such as sanitary exam bed covers, gloves, speculums, specimen cups, and so on. Now, let's meet those interdisciplinary teams who conduct the exams. Clinical teams will be supervised by an attending physician or nurse practitioner. They may be a faculty member from one of our partner institutions or an individual volunteer from elsewhere in the city. Depending on the personnel in attendance, they will conduct the patient visits or allow the residents to conduct the visit and present afterwards. They also supervise and provide instruction to medical students. Next, we have residents from the UNM School of Medicine. They will also conduct patient visits, oversee medical students, and present to faculty. Medical, PA, and nurse practitioner students from UNM assist the residents and attendings with the patient visits by taking notes, filling out forms, participating in patient interviews, and helping answer clinical questions. Fourth-year pharmacist interns from UNM's College of Pharmacy also participate in the patient interviews to provide consultation on prescriptions and to address barriers that may prevent the patient from adhering to prescription regimens, such as cost or side effects. Pharmacist interns are supervised by pharmacist clinicians, either faculty from UNM's College of Pharmacy or pharmacists from elsewhere in the city who have agreed to serve as preceptors. They will also join in on patient interviews for more complex questions. Finally, bilingual patient care assistants are our team of community and pre-med volunteers who serve at the clinic consistently, week after week. They develop relationships with the patients so they can fill in additional information about the patient's medical history. They may also participate in the patient interviews as needed, and they provide interpretation if the rest of the team doesn't speak Spanish. After the exam, patients sit down with a community health worker for what we call a salida, or an exit interview. The salidas are a central and unique part of our model that improve our ability to address social determinants of health so that what happens in the exam room can translate to real life. In the salida, the community health worker makes sure the patient understands their diagnosis and treatment plan, verifies that the proposed plan is feasible, and if not, asks the doctor for a plan B, answers any additional questions the patient may have, makes copies of all requested referrals, prescriptions, and other information given to the patient, and helps resolve other needs the patient may have, such as food, counseling, or legal services. Well, that's a basic introduction to the structure of our medical clinics. We're excited to have you on board. We'll be in touch soon about next steps to get you involved, and we'll see you soon.